Congress goes back to work next Tuesday, and of course topping the agenda is health care reform. North County Congressman Darrell, Issa, a Republican, is outspoken in his opposition to the House health care plan. Recently I asked him whether he thought the nation's health care really needs changing.
Absolutely. America spends almost double what most other countries spend on health care. It's a good system, but it's way too expensive, and ultimately the Medicare portion of it is leading to a dead end that's going to be extremely painful for our seniors and for the American taxpayer.
Where do you stand? What do you see as what's the Darrell Issa plan for health care reform? You had the magic wand, you could do it.
Well, the first magic wand is actually a bill that I authored, H.R. 3438, that simply allows every person in America, both individual and group, to sign up for the same health care program that I have as a member of Congress. You know, as members of Congress, we don't have a government solution. We have a couple of hundred different choices of health care plans, including Blue Cross and Kaiser and other names you know, that are reasonably priced, large pool, do not prohibit pre-existing conditions, do not raise or take you off of it if you have a health condition. We have exactly what many people are calling a good system. It's not cheap. It does cost, you know, it's a $7,000 a year or so, and it varies which one you pick system. But my bill simply says every American should be able to sign up for that. The small employer would be able to put 4, 5, 7, 8 people into this pool without having to worry about their individual pool, without worrying about the pre-existing conditions. And we could do that today.
How hard would that be? Why doesn't that seems to make sense? When you run up against that brick wall, why are you running up against the wall?
Well, because people really want something bigger. And, you know, we look at Congressman Filner and other progressives in the conference. They've signed on saying that if there isn't a government option, they won't vote for the bill. Well, why does there have to be a government option? Unless ultimately we're leading to socialized medicine, why is it we can't have a private solution? We already have government controlling 1 out of 6 people in America through Medicare, and almost the same number through the various programs for the poor. We already have government options, but who thinks Medicaid or Medicare are great programs? They might deliver some pretty good health care, but they deliver it by putting too much money at the problem and ultimately paying for it privately anyway.
Did you hold the town hall meeting?
I've held teletown hall meetings, and I've held meetings with veterans. I'm holding a teletown hall meeting on Wednesday in Vista at Rancho Buena Vista High School at 6 o'clock, and the doors open at 6. The event's at 6:30, and thank you for asking.
Okay, that's good. Do you understand the anger that you're seeing in town hall meetings, such as the one Susan Davis held recently, such as the ones you see around the country? Do you understand the anger that's coming out?
I understand the anger and the fear, and I think you have to be compassionate to both. The anger is, why is it government's trying to grab what is already a painful subject? You know, every family has spent a lot of money with a loved one who's at the end of life or who has a serious situation. And almost every family knows somebody who found themselves uninsured or with a pre-existing condition. And every American, I think, that is in a private plan worries about, will they keep the plan? What happens if they lose the job? What happens if they change jobs? So between the fear and the anger, I think we have to do something. It's one of the reasons that I think every Republican wants to see a solution that's done on a bipartisan basis.
And once again, Darrell Issa's Health Care Forum will be held tomorrow night at Rancho Buena Vista High School beginning at 6:30 p.m. And KUSI, of course, will have coverage of the event.
I imagine it will be well attended.
I would think so. Yeah, it's a town hall meeting. I would think so.
Popular.